let's get into strategies to reduce cravings. Because when you're working with a patient on weight loss, patient that have metabolic dysfunction, cardiovascular dysfunction, one is we want to look at their dietary and lifestyle. So what we can do is integrate more protein and fiber into their diet. When you integrate protein and fiber, we slow down the absorption of those sugars, of those carbs that we're eating. So we're eating bread, pasta, they're going to be broken down fairly quickly and spike our sugar levels. But if we add healthy fats to our meal, like add some olive oil to it, extra virgin is better. If we add some protein, right, we add some fish to it, or we add some grass-fed beef, for example, we are going to slow down and help to stabilize the sugar levels. One thing to remember is that exercise, for example, exercise is a great way to stimulate the function of our mitochondria, the energy factory that helps to break down sugar. It also helps to balance cortisol levels, stress levels. So those all are really important. Sometimes we mistaken thirst for hunger or sugar cravings. So also remember that we have to make sure that we drink throughout the day sufficient amount of fluid so we hydrate well. I would also recommend to eat throughout the day. One of the misconceptions that we talk about in the functional weight loss classes is the misconception of counting calories to lose weight. And that is, while beneficial for some patients, we show how the studies are showing us that when we count calories, our body slows down our metabolism. So it's counterproductive. Also, dieting with counting calories is not sustainable in the long term. So we want to eat. We want to eat to maintain a healthier weight. And eating complex carbs, for example, legumes, integrating legumes into your meal, beans, those are really, really beneficial in terms of having a healthy weight, right? So integrate legumes, integrate nuts into your diet. There's actually a study that showed that when you eat nuts, when they added nuts to a group of individuals' diet, they actually lost a little bit of weight, right? So really interesting. Make sure you eat throughout the day. A great, wonderful snack in between is an apple or a protein bar, a handful of nuts. That's a wonderful snack to help keep your sugar levels more balanced. Also, make sure that your adrenals are working properly. Optimal function is important because adrenals secrete cortisol, which balances our sugar levels. So if we secrete too much cortisol, we have higher amounts of glucose. If we secrete lower amount of cortisol, we have lower levels of sugar. So those are more of the strategies, the lifestyle strategies that we look in and dietary strategies that we look into. Sleep is also very important, right? So we want to make sure that we sleeping well, we get good quality sleep. If your patient have sleep apnea, they're tired during the day, send them to a sleep study so they can evaluate that, right? Make sure that they evaluate that. So now that we are equipped with 3 or 4 good lifestyle dietary strategies, Dr. Chill, take us through the first supplement, the first natural supplement that was found in studies to be beneficial.
This is my approach when I'm working with patients who have sugar cravings. As we mentioned, we want to go into the underlying causes, right? So this is the blood sugar imbalances, the dysbiosis, maybe the mental emotional components. And once we start to look at that and we figure out what is the major cause or the underlying cause for the patients, and we're working on that, I use these supplements as they're going through whatever protocols that we're going through to balance out the blood sugar, to balance out the microbiome. So this is going to be as needed for your patients to help them get through that part as you're starting to heal them. Once they are healed, then you can use this more on an as needed basis for your patients. The first supplement is going to be gymnema. This is a plant that is native to India and Africa, and it's referred to as the sugar destroyer. And it's referred to that for a reason, because it has the ability to interfere with your perception of the sweet taste. And this is going to inhibit the sweet taste of foods. So patients will naturally limit their intake of sweet foods. So if they are constantly having sugar cravings, this is a good supplement to go to. One of the studies done on gymnema, and this was an earlier study, this was completed in 1990, and this was a non randomized study with 47 patients with type 2 diabetes mellitus. All the patients either received conventional medications, but 22 patients also received 400 milligrams per day for 18 months to 20 months. And what the authors saw, or what the study revealed, was that it reported an average of 29% reduction in fasting glucose levels in the group with patients who received gymnema. And it also helped with maintaining blood glucose homeostasis. And those were the ones that were given the gymnema supplement. So not only is it helping with decreasing the sugar cravings, but it can also help with the fasting blood glucose levels in patients that may have an imbalance of the blood glucose levels that we mentioned earlier.
I would say gymnemia is one of our secret weapons, if we can
Yeah.
call it like that, right? Gymnemia is something that we've used with every patient that was coming to see us in our diabetes program. One of the things that we have found in practice is that taking a little bit of gymnemia before you eat helps to significantly reduce the cravings of sweet after the meal. So this was really interesting. So with patients that would come in into either our weight loss program or diabetes program, we would say, take a little bit of gymnemia right before you have either lunch or dinner, and that kind of helps to reduce those cravings. Interestingly, if you ever take gymnemia in a tablet and you just kind of suckle on it for a little bit like a candy, and for let's say 2 or 3 minutes, and then you put something sweet in your mouth, the sensation of sweetness reduced significantly. So that also helps with kind of reducing that because you're not going to feel it as much. We need more data on this, on the effectiveness of this plant, but there are some interesting reports that long-term, 18 to 20 to 22 months of use can actually help support a healthier pancreatic function with diabetic patients. So it'll be interesting to see more studies on that. The next one that we wanted to mention after gymnemia is cinnamon. So cinnamon is extracted from the bark of various species of the cinnamon trees, and it is used in traditional medicine to support healthy metabolism, to actually speed up metabolism. And there was an interesting health study in healthy subject without a history of gastrointestinal disease, abdominal surgery, or diabetes, and those are healthy individuals. And they gave them 6 grams of cinnamon. Typically, it's given in divided dosage. So let's say 3 grams in the morning, 3 grams in the evening. And what they found is that it slows down stomach emptying and significantly reduces high blood sugar levels after meals. So this could be useful for patients with sugar imbalance. There are some interesting reports that cinnamon intervention resulted in a significant decrease in weight, in percentages of body fat, in cholesterol, an increase of good cholesterol, which is the HDL. So this could also help with patients that have unfavorable lipid profile, right? They got too much of the LDLs or the bad cholesterol and too low of the HDL, the good cholesterol, or too high cholesterol, triglycerides. This is something that could also help with their metabolism. Something to mention with those supplements that we mentioned is that from my personal experience, and as well as using those for years with patients that have diabetes, is make sure that you monitor the patient, because patient comes to see you on medication or metformin or insulin. When you start using those supplements, especially in higher dosages, what happens is their blood glucose level starts to reduce. So sometimes you have to readjust those. So we would always work with a prescribing doctor, make sure that they're monitored properly, and make sure that we also adjust the dosages when needed. But typically with gymnemia, it will be 400 milligrams per day. You can go up to 800 milligrams a day if needed. And then with cinnamon, I've even seen some positive changes with even just using 1 gram a day. But even 1 gram a day divided into like 500 milligrams in the morning, 500 milligrams in the evening, can have some positive impact on the patient's metabolism. So always monitor them. And again, pregnant, lactating patients, do not use that because we don't have enough studies to show the safety of herbs on women that are pregnant or lactating. So just to be on a safe side, that's really important. Dr. Chill, take us into kind of a summary of what's some of the options for them. Where do they start with when they first see a patient that struggle with sugar craving?
The first thing that you want to do is assess and then address the underlying causes. As you're addressing the underlying causes, using some of the lifestyle approaches that we mentioned, along with some of the supplement approaches that we mentioned, what we typically do in practice is we start slowly with the patients, right? And we try to meet them where they're at. So it might be one thing at a time. It might be just starting with the gymnema to help with their sugar cravings while you're looking into decreasing maybe or putting them on an anti-inflammatory diet. Or they might be able to do a 7-day no sugar challenge. A lot of practitioners will start their patients on some sort of challenge. This is where you're going to have to collaborate with your patients and meet them where they're at and figure out what they're capable of doing. Because what we're trying to do is have them succeed in their health goals. And so some patients may need a one at a time approach. Some patients may be able to do a 7-day no sugar cleanse right away, or they might even might be able to do a 14-day no sugar cleanse. And then you'll provide them with the resources as such as incorporating a no sugar plan. And this is going to involve both the steps to address some of the physical cravings that we mentioned, along with some of the psychological factors, addressing the underlying factors, and then having them look at healthier choices of foods and addressing things like their microbiome, their cortisol and their stress levels, their nutrient deficiencies. And this is going to, and then you're going to teach them about being mindful of their food choices by things like reading labels and then understanding the sugar impacts on health while creating a supportive environment for their success.
If you're interested in learning about these factors from a functional and an integrative medicine approach, I invite you to join our Functional Weight Loss Summit, where we're going to, together with several experts, dive deeper into the 5 major physiological factors that lead to weight gain in the functional medicine approach. We're also going to look into the specific functional or specialty lab testing to identify those root causes. And we're also going to look into how to create a personalized treatment plan for your patients. We're also going to cover the clinical application of nutritional, herbal, and probiotic supplements for weight loss from an evidence-based approach with specific treatment protocols. This event is live, so you can ask questions and you get all the recordings and handouts and clinical guides with it. You will also learn how to guide your patients towards better health and function so they can feel and look better. Click on the link below and secure your ticket now. I'll see you there.